A very good afternoon, everybody. Welcome back to the channel. Today's session is going to be very important, very useful session, and it will be pertaining to the OET introductory class. The purpose of this class is to help the candidates, the health professional, understand why OET is a better exam for you rather than IELTS. It will also explain to you the structure, the parameters, the marking scheme, and all such details which will help you decide. So without any further delay, let's begin. Okay, so I'm going to be just doing the share screen. Give me a moment. Okay, as you can see on your screen, there you go. Give me a moment. Okay, so here you can see what exactly is OET. Give me a moment. Okay, so OET stands for Occupational English Test. It is a language test recognized by Australia, New Zealand, Singapore, UK, Ukraine, Namibia, and Dubai, and now even US, to assess the language communication skills of healthcare professionals who wish to register and practice in an English-speaking environment. All right. So, as you know, there are various other exams like IELTS, TOEFL, PTE as well, right? But then these exams are for anyone or everyone who wants to either study or migrate to English-speaking countries. So why was there a need to get an exam like OET? What was the requirement? What was the need? The reason for that was because this exam was the best tool to assess the language skills of a healthcare professional, which means that it was asking you questions which are pertaining to your own profession, which you have been dealing with, which is easier for you to solve and score. We'll see why it is like that in the future, in the coming slides. So these are some of the countries who accept, right? Namibia, Australia, UK, Singapore, New Zealand, right? So these are the countries which accept this score, and now even US for Florida. So these are, these are some of the highest paying countries. According to the data, like Netherlands has really been $22 per hour, Sweden is $17 per hour, US $16 per hour, and this is previous data. Right now, it's going to be even higher, right? Top five countries are Australia, so Denmark, Australia, and Ireland, the US, and Luxembourg. Annual average salary in these countries are 54,000, 56, 64, 70, and even 82,000 respectively, according to the US. So you see, Australia, you can earn like almost 30 Australian dollars. You can also almost earn 26 or 27 Australian dollars per hour, $30 for Ireland, $33, and $39 for Luxembourg. So, of course, we understand that we have chosen the health professional, and for a very probable reason that it's a noble profession, right? Um, Mary, you can participate if you want. Yeah. So you have chosen this profession with a sense of that it's a noble profession, and you want to contribute to humanity, and it's a great job done by you all. However, the another reason is that it is a well-paid profession. It opens your career prospects, and you can travel all around the world. I mean, it opens nursing is the easiest profession for your migration. For
Yes,
other
right.
candidates, they really need to give IELTS, get high scores, 7 in writing. It's tough. My students have done it, I know, but the thing is that it takes tough. It takes a lot of hard work, which most of the nurses who I know, my students, most of them are busy with the dealing with the the job itself, which can be taxing at times. So IELTS gets a very hard nut to crack. But then
Yes,
you have
definitely.
OET for your rescue. So now, OET is a specially designed test for healthcare sector practitioners who are moving to an English-speaking context. OET test proves the English language proficiency in the healthcare sector. The maximum time limit is 3 hours. OET test is valid for 2 years from the date the test is taken. So even if you give now, maybe say after 3 4 months, it's going to be still valid for the next 2 years. You can simply give the exam, get your result, and then you can relax and you can prepare for your next exam, which is the CBT, right? CBT
Okay.
or any other exam that you're planning. Okay, so here
Yeah.
there are the health professionals which can take advantage of this amazing test. The first is nursing, the most popular. Then comes medicine. My current students are doctors as well. Dentistry, dietetics, occupational therapy, optometry, pharmacy, physiotherapy, podiatry, radiography, speech pathology, and veterinary science. So this is the most in-demand profession, the one which you're in. Congratulations for that.
Yes.
Now coming to the exam segments, listening, reading, writing, and speaking. The way you have these four sections of IELTS or TOEFL, you have the same four
Okay.
sections. Now the difference is that in listening, in IELTS it's almost 30 to 32 minutes, 30 to 32 minutes, and here it's at approximately 45 minutes listening. Reading is going to be 60 minutes, then it will be writing, which is 45 minutes, followed by speaking, which will be approximately 20 minutes. So now I'm going to be giving you a breakup of these different categories. So a listening section is further divided into three parts. Okay, now let me tell you, listening test will include 42 questions. How many questions? 42.
42.
42. Out of that, in order to get your required required grade, which is a B grade, you need to score a minimum of 30 out of
Okay.
42, which means that you can afford to make not more than 12 mistakes. Okay, so you
Mhm.
can maximum you can make 12 mistakes, and that's about it. If you make if you get 29, you fall down to a C plus, which is not acceptable for
All
your
right.
for your success, right? It is only acceptable in C plus is acceptable only in writing, okay, for UK,
Okay.
or 6.5. Rest all have to be minimum B score. Earlier, writing used to be also B, but then I know writing is gets tough for the nurses and doctors. For doctors, it's still B. Nurses, it's C
Okay.
plus. Okay. Now coming to consultation extracts. So this breaking into three parts. The first few questions are consultation experts. Basically extracts. So it's going to be like, for example, you dealing with patients, or there'll be a dialogue between a patient and a nurse, or or a patient and a doctor. They will be discussing about maybe sign and symptoms, or medication, or a body part, or the color, right? All these things. This is going to
Okay.
be like fill in the blank question, which is the most easiest part, really. If you score well in this, you can really get your score. It is very easy. It's as simple as, just imagine that, suppose we play a game and I'm sitting on a terrace, and I have a ball I'm throwing down to you, which you're on the ground floor. You have a basket in your hand. You need to just simply catch the ball. Okay,
Yeah.
so you simply need to catch the particular word that they need, and you will be given certain seconds, around 60 to 90 seconds, to go through and see the questions beforehand. This will help you to understand. This will help you to understand and know what kind of questions you can expect, right? So,
Okay.
some of them, you can use your common sense. You can get an idea. Okay, this will be a body part. This will be a sign and symptom. This will be a vaccination. You can already make out by when you look at these questions, right? So next is
Yeah.
going to be short workspace extracts. Now you're dealing with your colleagues from various departments, right? You're dealing with
Yes.
the X-ray department. You're dealing with the you're dealing with the X-ray department,
Operation.
your operation department. You're dealing with the
Yes.
blood bank. So
Housekeeping.
housekeeping. So basically, so here it will not be exactly housekeeping, but it will be people who are from the medical profession, but different departments. So workspace extracts means there will be dialogue between two people. See, earlier it was a
Yeah.
healthcare profession and a patient, right? This time is
Yes.
going to be both will be healthcare professionals, and they'll be discussing certain aspects of the job. Okay, and
Okay.
this will be like okay. So the first one, A part, is going to be continuous conversation, and you cannot stop
Okay.
it. It will be continuous. You'll have to write the answer as you listen. Okay,
Okay.
you cannot stop, of course. It will go as you listen without a break. In the B
Okay.
part, in the short works extract, there will be one conversation, one question. Okay,
Okay.
then there'll be another conversation, another question. Okay,
Okay.
then another conversation, another question. This will be around 6 to 8 questions will be there, and so this will be based on this will not be happening in one flow. It will be a conversation, and then it will be a
Question.
question, a question with options. Yeah.
Okay.
So yeah, okay, yeah, this is going to be multiple choice questions. Okay, these will
Right.
be multiple choice questions. So they will give you a question, there'll be options.
Okay.
Okay. Okay, so the thing is that it will be uh, so you will have to choose the correct option. You'll have to choose
Okay.
the option which is correct, right?
Okay.
And of course, see, there's no negative marking.
Okay. That's great.
Yes, so so that's the thing. Okay, good.
Okay.
So there's no negative marking, so it means that you definitely have to attempt it. Don't leave any question.
Anything.
Yeah,
Okay.
because there is nothing to lose. Okay.
Okay.
Okay, now coming to the final one, which is the most difficult part, is presentation experts, where they will be, for example, now I'm giving you presentation on OET, right? Similarly,
Yes.
there will be a professional who will be giving you presentation on a particular healthcare topic.
Okay.
Okay. uh,
Okay.
okay, so now the way you're so the way you are following my presentation, in the same way you'll have to follow what this person is, what is the speaker saying, and it will not be stopping. The conversation will not stop. It will be continuous conversation, and questions will there'll be a sequence of questions. Okay, so you listen,
Okay.
you answer, at the same time you look at the option. Okay, you listen, you answer,
Okay.
and when you answer one question, go to the next one. Now the thing is that if you skip, suppose you skip one question, do not get stressed. Okay,
Okay.
because and do not try to chase the question. Which is gone is
Yes.
already gone, you cannot change it
Okay.
now, right? And because it's listening, no matter how much you try, what will happen is you become anxious and you will lose on the next question as well. So the first
Yes.
one you try to chase the first one, you lose it. Then the time when you're thinking about the when you're thinking about
Previous
the
ones.
the previous one, then the second one will go, then the third one will go. It will be a chain
Exactly.
reaction, and your whole exam will be unsuccessful.
Yes.
Why? Because
Yes.
see, already your confidence will go down. When your confidence goes down,
Exactly.
you already you don't feel like, okay, the next sections are worth attempt. And it has happened. That's why I'm telling you, it happens with students. So we have to be
Okay.
very calm. We have to be very calm.
Mm-hmm.
Even if we leave, even if we did not get one or two answer, that's fine. That's fine, because
Okay.
you are to get 30 out of 42. All right, okay, let's go next one.
Okay.
So the traits that are assessed in the listening segment include capability of identifying specific and precise information. So your capacity to identify specific and
Yes.
precise information. Please understand that these accents will be UK or like British accent or Australian accent, right? Or even Irish accent.
Yes.
So you need to be
Okay.
and you need to make yourself ready with these kind of accents, right? You need to listen to
Mm.
more and more native speakers, right? Now, second is
Right.
efficiency of identifying the details. So, how good you're able to identify the details, right? How well you're
Okay.
able to check, identify the details. Okay. Next, determining the purpose of short expert. So basically, exactly, this will come in the multiple choice questions, where they will be giving you there'll be a question, and they'll say what was the purpose of this question, right? What was the reason behind this conversation? So what is the
Okay.
main idea behind it? Okay, so that will be one. Then fourth, ability of following a presentation on different healthcare topics. So how conveniently you can follow these different topics, right, in a way that you understand whatever they're trying to say. So basically, how
Yeah.
you're able to follow it. That's the thing. So if you even if you miss
Okay.
out one or two questions, that's fine. We'll go to the next one. Is it clear? Listening is clear?
Yes. All right. Yes.
Very good.
Got it.
Now let's go to speaking. Now the way in IELTS speaking gets tough because you need to speak for 2 minutes on a new topic that they give you right away. You just have 1 minute to prepare, so you need a lot of
Mm.
imagination, you need vocabulary, you need a lot of uh, extra things which not everybody is able to generate those imaginative thoughts on the spot. For example, in IELTS, you might have a question like, talk about your the most important historical event in life, or talk about your favorite color and why do you like it, or something like that, or talk about a day when the weather was beautiful, talk about your most embarrassing moment, right? So that
Yes.
will be the kind of questions everybody is ready to answer, right? Because it
Mm.
it takes imagination, and I can understand as a nurse or health profession, when you're working for one particular profession, you get so used to only doing that job, coming home, family, and then you go again, do the job, come home, responsibilities, you get so involved that your imagination and that vocabulary kind of shrinks, right?
Yes.
you,
Definitely.
you you agree on that? It happens, right? Not only with you,
Exactly. Yes.
it has been happening with all my students, and I know for a fact why that happens, because there is no need to think something extra. Okay,
True.
so now this is where OET will help you. How? Because
Okay.
OET will not involve such questions where you need to talk about anything from anywhere within 1 minute. This
Okay.
will involve role plays, medical role plays. Now role plays basically means situations where you're dealing with patients on
Mm-hmm.
various situations. For example,
Okay.
say angina pectoris, heart attack, Alzheimer's, or osteoporosis, maybe constipation of a child, um, accident, right? Blood
Okay.
transfusion, stroke, chemotherapy. So, do you not know about these? You know
Yes.
about all of
We
them.
do.
You
Yes.
know about all of them because you have done your studies, you have proven yourself as a health professional, and you are already equipped with this knowledge, correct?
Yes.
So now
Correct.
this will mean that see, I understand one more thing, that see in India and even here in Middle East, I see nurses, they don't get time to interact with patients a lot. Okay, I've seen that.
Exactly.
It's mainly just give medications, just help the doctor with the certain things, and take the blood, take the temperature, right? That's about it, right? But now please
Yes.
understand, in UK, in Australia, or Ireland for that matter, New Zealand, there's a lot of interaction which happens. Okay, there people like to
Okay.
talk. You will be dealing with people. You cannot be in the corner and not communicating. All right. So you will
Yes.
be given different situations. What I'm going to be working on is your communication. Okay, not your medical
Okay.
knowledge, not your medical knowledge. Okay, it is 95% English exam. All right.
Okay.
So
Yes.
medical knowledge you already have, even I have for that matter, because I have done a first aid course. Okay,
Okay.
sorry, I was with an international airline. I was traveled 60 countries in my life,
Um.
and yes, and I did go through the safety training, fire safety training. I did a first aid course, so I do
Oh, great.
understand the specification of the body, right? So that
All right.
actually
Yeah.
helped me in becoming an OET trainer, because I have gone through that training, right? so
Okay.
now so now the thing is that now you need to use your knowledge. See, the good thing is that your knowledge is not going to get wasted, right?
Definitely.
Your
Yes.
knowledge will help you in this exam. In IELTS exam, your knowledge is not going to help you. You're as good as any other person who's
Yeah.
maybe an engineer or an author or an accountant, right? So you don't have an advantage. All right. And they might be good speakers than you,
Yep.
or we see, first of all, it's not about competition anyway, but what I'm saying is that they might be,
Exactly.
yeah. So this is
Yeah.
where your advantage is, that you have knowledge on this subject, and that is why this is the exam for you. All right.
Yeah. Right.
They don't have that facility.
Okay.
Okay. Okay, now, so now let me just explain to you.
Okay.
They'll be speaking. Now, speaking, there'll be two role plays. Okay, there's role play, there'll be two role plays. One will be the easy one, second will be the difficult one. Okay, so there are two types of role plays. The first one is going to be the easy one, second is going to be the
Okay.
difficult one, right? Difficult in what sense? What do you think about difficult? uh,
Mhm.
have you been dealing with difficult patients? Sometimes whatever you tell them, they will say, no, I will not, no, I don't want to do this, no, I don't. Can you, bothering you?
Yes.
Have you so that is called difficult situation,
Yes.
right?
Yes.
Difficult patient. Okay, no matter
Yeah.
how
We
much,
have.
and I'm sure you have faced it. Okay,
Okay.
so now the first one is going to be very easy. Like for example, there's
Definitely.
a
Yeah.
there's there's a mother whose child has got constipation. She's worried, or maybe she needs help with the
Mm.
breastfeeding, like a consultation, or someone met with an accident, or maybe chicken pox,
Mm.
common things which maybe they don't know about, like maybe seizure. Okay, I'm
Yes.
not seizure is not
Okay.
common, but still, I mean, you got the idea, right? Basically informing people what it is. Okay, so that is
Yes.
going to
Yes.
be easy. So the time is going to be 3 minutes for preparation.
Yeah.
Okay, 3 minutes for preparation and 5 minutes for speaking.
Okay.
Okay, so you will get a card. They'll be getting a card
Right.
where the situation will be given, and based on that situation you'll be
Okay.
preparing yourself, you'll be writing small notes, and based on those notes you will prepare your topic. And I
Okay.
sent you the video already from my channel. I have done a lot of role plays on my YouTube channel, right? So when you want to check how to do it, you can of
Okay.
course check my channel. You will see how I am doing the role plays, how to approach these questions, right? They all need very different skills. For example, you will be
Yeah.
introduced. So first is introduction, then maybe empathy, then explanation, or reassuring, right? Okay, explanation or objection handling,
Okay.
right? Empathizing, then summarizing as well, summary. Okay,
Okay.
so basically you'll be using your knowledge and to
Mm.
you to tackle this role play. Second one is going to be a difficult one. Okay, they will try to be difficult, they will try to make your life difficult, they will
Okay.
try to, whatever you say, they will try to say, no, I don't want this, or you say, someone will say, I'm too old for chemotherapy,
Right.
and what if it's safe for me or not,
Okay.
like that, and you will have to handle their objection. So you'll see how politely, with confidence. So it's like politely
Okay.
with confidence. It cannot be only polite with no confidence.
Okay.
No good, right? It cannot be only confidence, but you're not even polite, you're so
Right.
rude. No use,
Definitely.
right? Because we're dealing with people, and you see,
Yes.
nobody comes to the hospital when they're fit and fine.
Mm.
Okay, mostly people are, having problem, they're suffering, they want
Exactly.
a voice which will say, I will take care of you. They want someone who will reassure them, who will say, I understand
Exactly.
what is happening, but then we are there for you, we are a team of health professionals, we will take care of you, right? So you got the idea, right? Okay, so now let's see, what are the skills required that are executed which help analyze the following traits. First is language fluency and speed. So how fluent you are with the language, right? And do you speak too fast or do you speak too slow? It should be moderate.
Okay.
Okay. A language fluency means you should not have too much fillers, right?
Moderate. Yes.
Pronunciation, vocabulary, and accent. So your accent should be something
Yes.
which is universally accepted. Which is okay. The way my accent is not exactly like this, but something that people can understand from anywhere. Okay, so there are many sounds which candidates mispronounce. For
Got it.
example, in North, like instead of saying sure, they say sir, right? And instead of in South, I noticed that instead of say,
Okay.
a call, they'll say call, right? Or roll, they'll say roller, right? twisting the tongue.
Yeah. True.
Yeah. So I noticed that because I've
Yes.
been teaching student, I know. And
Yes. Yes.
instead of important, they might say embodied. So where the t sound is coming, instead of t, they're putting the
Yes.
d
Yes.
sound. So I am working on those aspects as well. Okay. I'm not only just working for your OET, but I am working to
Okay.
polish your communication, right? Because you need to be someone who person from
Okay.
any other country can understand, and that's where I come into picture. Because I was working with my colleagues from all different
Okay.
countries. My colleagues were from Europe, from Thailand, from Korea, Japan, China, Africa, Mongolia, right? Brazil, India,
Okay.
everywhere. So that's why I understand what is the international language. Okay.
Alright.
And that's what I'm going to be helping you with. Next is ease and comfort of
Okay.
explaining technical terms of medical matters. So,
Sure.
so for example, now what is ease and comfort of explaining? So someone asks you, may I know how the blood transfusion is conducted? So you should be able to explain what. Can you please tell me what exactly is a seizure? Someone asks you, we have to make full, complete sentences in a very professional manner. I mean, and
Okay.
we don't have to use too much medical terminologies. Okay. For example, if someone asks you, can you please tell me what
Okay.
exactly is epilepsy? If I ask you, for example, what exactly is epilepsy, please,
Okay.
what would you say? Now I'm asking you, what would you say? Someone told me
A
I have
series.
epilepsy.
Yeah, it's a series of she's us.
Mm-hmm. Seizures.
Yeah, it's a series of she's. Eventually, it's like
Seizures.
become chronic. Yeah.
Okay, okay. See,
Yeah.
now this is not a complete sentence, my dear. Okay, this is not a complete. You need to make complete sentence. For example,
Yeah.
epilepsy.
Yeah. That's what.
Epilepsy. Yeah, epilepsy is a medical condition which is caused by electrical disturbances in the brain circuit. Right? Am I correct? In the electrical
Okay.
disturbances
Yes.
in the nervous system, right? In the neurological system. Correct?
Mm.
So
Yes.
which results into seizures. So basically, if someone wants to explain, okay, then you should be able to do justice to that. Clear? Okay, now coming to your
Okay.
so you got it right, ease and comfort. So if someone asks you, you should be able to explain it easily. That's the point, right? Okay, next
Okay.
is
Mm.
understanding and patient perspectives and understanding patient perspectives and needs. Okay. Okay, so basically, if someone, so suppose
Okay.
there's a gentleman, there there is a situation where a person is saying that he is suffering from UTI, and he's admitted in hospital, but his wife, she's partially blind, and she has bronchitis. She's alone at home.
Okay.
Now we need to understand what is his main concern. He's saying, I'm not worried about myself that much. I want to know when I can go home because my wife is alone and she's partially blind. So we have to understand his perspective
Okay.
and needs. See, speaking is just not about talking, okay? It's not about talking, it's about listening, understanding, and then
Yes.
responding, right? Okay, then appropriate, attentive, and respectful attitude along with empathy. So the way we are listening, we are nodding, we're saying, hmm, okay, right, I understand. Whenever they're speaking, we should not be like staring at their face like blank. They will think something is wrong with us. We have to, okay, right,
True.
yes, yes, okay,
Respond.
I understand you. So respectful attitude along with empathy. Okay, so appropriate, attentive. How can you be attentive?
Okay.
Your body language, your eyes, your hands, right?
Responding. Yeah.
Responding, yes, means acknowledging.
Yes.
Next, proper use of questions and usage
Yes.
of vague statements. So you have to ask them the correct questions. If someone is smoking a lot, or they drink every day, you cannot say, uh, so do you smoke? You can't say that. You cannot say, so do you drink also? That's not the right way. We're not talking to our friend. We can say,
Mhm.
may I ask you a
Yes.
few questions, if you don't mind? Let's say, yes, please go ahead. Sir, I wanted to know approximately how
Yes.
much do you smoke in a day? And say, Oh, approximately half a packet.
Okay.
I okay. I see. So we will not say five pack, half packet, too much. Yeah, that's very bad. Leave it. We cannot say like that. We'll say, I understand. I mean, that's quite a lot.
Okay.
I'm sure you agree that it's a lot, right?
Okay.
So have you considered doing something about reducing it,
Yes.
something like that, talking to them, having a conversation? And if you say, how much do you drink as well? They say, yes, I do. And how much do you drink? They say, if I'm drinking every day, I like my wine every day. Then you can say, oh well, there's no harm in wine, like even I like my wine, but only thing is that currently your blood pressure is very high. So according to this situation, don't you think it's a good idea that we should work towards it? So talking to them, telling them, asking them questions that they should
Yes.
not feel bad. Okay. So next is ability to summarize
Yes.
information. Ability to summarize information. So you have spoken to them. Okay. You have spoken to them, and finally you are summarizing to them,
Okay.
summarizing whatever you have discussed. Remember, this is all going to be in 5 minutes, my dear. You have to answer, so there are three questions, you have to answer all the three questions.
Okay.
Okay, if there are four questions, you need to answer all the four questions, and you need to
Okay.
summarize, and this has to be before 5 minutes. Is it possible to reduce the background noise a little bit, if it's possible?
Okay.
Okay. So okay, so now so you got it right. In the end, we need to summarize. All of this has to be before 5 minutes.
Yes.
Okay. Next is logical and purposeful
Okay.
interaction. Okay, logical purpose interaction means we are speaking in a sequence. Okay, first we introduce, then we empathize, then we explain, then we reassure. Right? We cannot be doing like summarize, reassure, empathize. We don't do that. Right? It's a sequence. Purposeful interaction, organizing the thoughts. Okay.
Yes.
Next, explanations in proper sequence using the best techniques. Okay, so how you explaining using the correct method, right? So that's your speaking. Okay, now this is a role play,
Okay.
but I will skip it. I will do I'll You can, because I sent you the channel link, you can check from my channel the speaking, right? Now I'm explaining you the various parts.
Sure. Yes.
Now coming to reading, yeah, reading is a very important part. In the same way, you have same number of questions. How many questions? 42 questions. It is also objective type. So uh, so
Okay.
listening and reading, both of them are objective type. Okay, both of them are objective type questions.
Okay.
Same number of questions. How many? 42. And how much you need to get? How
42.
much you need to get? How much you need to get?
30.
30. So this is going to be having part A, B, and C. So two different sections. One, you'll have to be expeditious reader, and one you have to be an active reader. Now let's understand what exactly is expeditious reader. Okay. Now, uh, part A will be how many questions? There'll be 20 questions. You can write it down if you want. Part A will be 20 questions, or I'm even recording it this video actually. And part you'll be how much time? You'll be given 20 minutes. So sorry, 15 minutes. So you have 15 minutes, and you have to answer 20 questions, which means that you might don't even have 1 minute for one answer, right? What does it mean? This means that you have to be really, really quick.
Yes.
Okay. So expeditious reader
Very
means
fast. Yes.
expeditious reader means that you need to, what you need to do is you need to come, and you need to read very fast. Okay, you need to skim and scan the information. Okay, you need to skim and scan the information, which means that you cannot be reading each and every part in detail. Okay, because if you do that, you will run out of time.
Okay.
Okay, if you do that, you will run out of time. Okay, so all
Okay.
you have to do is you have to read it very fast. And
Okay.
also remember, you will have 15 minutes to answer 20 questions, which means that after 15 minutes they will take the paper away. They will take the paper away, right? So if
Okay.
they take the
Okay.
paper away, then you cannot be using the because it's a 1 hour test. Okay, 1 hour test first is 15 minutes. Okay,
Okay.
so they take your paper away. Then you have 45 minutes
Okay.
for part B and part C. That is 45 minutes. Okay, so that's one. So first is going to be expeditious
Okay.
reader. You'll be reading very fast. You'll be reading very fast. Okay, and then part B and part C, you'll have to read in detail. So first is quickly scan through the text, locate specific information. All right. So part A is about scanning through the text. So there'll be four
Okay.
texts: text A, text B, text C, and text D. So you'll put 15 seconds in each text. 15 seconds for A, 15 seconds for B, 15 for D, 15 for. So that'll be 1 minute gone, and you'll have 14 minutes after you read the text. So 14
Okay.
minutes you'll have to 20 questions. Okay. Now part B and part C. Other two careful reading tasks assess the participant's capability to identify specific details, main points, and summary of the text effectively in a given time. It also assesses the ability to identify meaning and opinion of the text given the topic of healthcare. So here you'll be identifying the main point of the summary. So here, so first 20 questions will be part A. After that, part B will have 6 questions. All right, 6 questions. So there'll be one text and
Okay.
three choices. So there'll be one text and three choices. So it will be six different short texts. Okay.
Okay.
So that's going to be 6 questions for part B. And
Okay.
part C will be 16 questions. Okay. So 20 plus 6 plus 16 is 42.
Okay.
So, but part C will
6
have,
by 16.
yeah,
Okay.
part C will have long texts. Okay. It'll be 6 7 paragraphs, and there'll be questions back to back. Okay. The same, like
Okay.
listening part B had one question one text, one question one text. It is same way. Part B will also
Yes.
have
Yes.
one question one text, one question one text, and part C will have long text and questions back to back. Okay, so idea is that
One
you need to
question.
score at least
Okay.
maybe 15 out of 20 in part A. Okay, 15 out of 20 in part A. Then
Okay.
um, the next out of 6 you need to get 4 out of 6. Okay, 4 out of
Okay.
6, yeah. And last 16
Okay.
questions you need to get. Then so for example 15 plus 4 is how much? 19. So then out of 16 you need to get at least 11 correct, or you get 16 correct in part A.
Yes.
Okay, 16 in part A plus
Mm-hmm.
4 from part B, which will be how much? 20.
Okay.
20. So then out of, so you need how much
20.
more? You have 20, you
So
need,
another
for
10.
30 you need 10 more. For another 10
10.
you need to get, you need to get
Yes.
10 out of 16, which means out of 8 you can even make 3 mistakes. Even if you make 3 mistakes, it's fine. Okay,
Okay.
so that's fine. So now
Okay. Got it.
and now it also is the ability to identify meaning and opinion of the text given in the topic of healthcare. Okay, this is done, clear? Okay, now let's come into the main
Yes.
part of the OET, the most important part, which is called writing. Why is writing challenging in most of the exams? Well, the
Okay.
reason for that is first of all, it's not objective type. All right, you need to create something. You need to create something out of
Okay.
nothing. I mean, you have nothing and you need to create so much. Okay, in IELTS it's even more challenging, because in IELTS you are given a topic
Yes.
for which you need to write ideas. You need to create ideas. You need to write essays of which you might not have any knowledge about. Okay, so
True.
okay, you don't have any knowledge about it. For example, there might be topics like education, healthcare, sports, media, technology, information technology, right? Crime,
Okay.
right? Society, all these things. So you need to really generate a lot of thoughts. And there are two tasks in your IELTS. One is a letter and one is a essay. But now the advantage in OET is there's only one question. First thing is there's only one question. Timing is 45 minutes. So 5 minutes for reading and 40 minutes for writing. Okay. And now, uh, so there's only one task,
Okay.
and that is a letter. So letter might be, you know, so letter might be a referral letter. Okay, or a letter of discharge, okay, or a letter of uh,
Okay.
advice and further management. So you see, these are familiar terms, right? These are familiar terms. You know what is a discharge, you know what is a referral,
Yes,
okay,
yes.
all these things. Okay, secondly, the thing is that what happens is that you need to, you will be getting case notes, okay? So you'll be getting a lot of case notes. You know what a case note, right? Patient's case notes.
Okay.
So based on the case notes, you'll be arranging the
Yes.
information in a
Mm.
manner that is easy for the reader to understand. Okay, so what are case note include? They include what? Details, right?
Okay.
Medical history, social history, nursing
Yes.
management, right? Discharge plan, right? All the things are included in
Yes.
your case notes. All you have to arrange them
Yes.
in a
Yes.
manner. It has to be within 45 minutes, and the word limit is 180 to 200 words. Okay, it is not a fixed limit. It's not that after 200 you need to,
Okay.
you will lose marks, but try to keep it 10 to 15% more or less. For example, you can keep 220, 225 words. I mean, that's about it. 215, 220, like that, right? So you'll be given case notes, okay?
Okay.
You'll be writing either a referral letter or a discharge letter. So now, so it will include, for example, it will include the address, the date, the name of the person you're writing it to, the details of the patient, right, and the date of birth and all. Now,
Mm.
after this,
Yes.
what will be happening is that then you'll be writing introduction, right? Then you'll be writing introduction, okay.
Okay.
After introduction, what will you write? You'll be writing medical
Forward.
history, right? Then you'll be writing medical history. Then you'll be writing social
Yeah.
history, okay. Then you'll be writing social history, okay.
Yeah.
Then
And
nursing management,
mm.
right? And then finally discharge plan. So it depends on the letter to letter. So what are the things which are very important for this? Purpose. So the purpose should be immediately apparent and clear. The purpose of the letter should be immediately apparent and clear. Okay, so why
Okay.
are we, for any letter to write, we are writing for a
Okay.
reason, correct? Okay, so
Yes.
so now
Correct.
it should be very clear, why are we writing this letter? So I'm writing to refer so and so, I'm writing for the purpose of discharge, okay. Who is a known case of whatever it is, right? Whatever his
Yeah.
problem is. Second is content. The content means what are we
Mm.
writing must include necessary information. That information will be accurate, which means that your case notes will have a lot of information, okay. But
Yes.
will you write all of it?
Yes.
No, you cannot write all of it,
No.
my dear, because 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 case notes will have a lot of information which is unnecessary for today, okay. Today he's coming for a particular purpose,
Yes.
right? Will you write what happened in 2008? He fell from a bike and broke his elbow, but today he has asthma. Is it related to it? No, right? It is not related, right? If he has asthma
No.
today, if we say the case notes say he
Yes.
had a bike accident 2008 and had an injury in the elbow, it is not related, correct? So we will not write everything. We will have to
Yes. Correct.
find out what is necessary, what is unnecessary, okay, what is unnecessary, and we'll be putting
Okay.
only information which is
Okay.
relevant. For example, now if I send a patient to you with all his history in the letter, you will go crazy. You
Okay.
will say, my dear, please tell me, what do I need to know? Isn't it?
Correct. Yes.
Because
Right.
you need to look into it fast. So it should help you to get the information fast, correct?
Yeah.
Okay, so conciseness and clarity means excluding the
Correct.
irrelevant information, only including what is relevant to the reader. So when you get a letter with a patient, you want to know how you can help this person. You can help only when you know information which is relevant to today, okay, related to today's, what is his disease today,
Yes.
right? Not like 10 years ago. Yes, if it is related, if it is related, if there's a
Yeah.
history of same repetition, maybe heart attack or a surgery or a diabetes, something which is related, this, then you need to know that, correct? So that's the thing. Next is genre and
Yes.
style. So
Yeah.
means the way you write your letter must be suitable for the intended reader. The way you're writing must be suitable. You're writing it to the, maybe the home care nurse, or the you're writing to a gynecologist, a physiotherapist. Who are you writing it? Should depend who are you writing it to. It should be suitable for that person, okay. Means you have to write information which is useful
Okay.
to this person, clear? Now, organization and layout means your
Yes.
letter must be structured to aid the retrieval of information, which means when you get a letter, you want it to be clear and easy to read, isn't it? Not for you to getting confused and wasting time, which means it should be
Yes.
in a sequence. As I said, introduction, right? Medical history, social history, nursing management,
Yes.
and your discharge plan according to that, right? So
Discharge.
now coming to language.
Yes.
Language should also aid the retrieval of information. Your language should be such that it is easy for everybody to understand. All right. So language should make it easy for
Okay.
everybody to understand. All right. So why should I take it? As I, now you know why you should take it,
Got it.
right? It is an easier exam as compared to IELTS. Examination fees 587 Australian dollars globally. Okay. In case you are not ready for the
Okay.
exam but you booked it, are you allowed to withdraw? Yes. You need to 24 hours before you can cancel it, and you can you get your refund, but only 7 Australian dollars will be charged for the cancellation fee. Refund you'll be getting after 20 days, and the results are generated after 17 working days.
Okay.
So this is the table. As you see, this is what we're aiming at,
Okay.
Mary. B grade or 7 or 7.5. On the left you see OET,
Okay.
and on the right you see IELTS results. So you need to get a
Yeah.
minimum 350. This one I have explained to you already. See, 350 is
Okay.
minimum. The moment you get 340,
Okay.
you come on up to C plus or 6.5. You can get 6.5, but only in writing. Okay.
Okay.
The rest all you need to get B. Okay. So
Okay.
this is equivalent
Got
of
it.
IELTS, but this is easier
Okay.
and this is more difficult. Okay. That's why I'm suggesting. So what is the
Okay.
methodology? What I do here is, right, my methodology is that first on joining I'm going to doing an assessment, right?
Mhm.
I'll see what are you good at. Are you good at your speaking, writing? Like most people struggle with speaking and writing. Okay. So I'll be working on those particular areas. Then I'll give you total full
Okay.
introduction of the OET, all the structure with the material and everything, right? Then identifying your area of improvement. Now, if
Okay.
you're a good speaker, will I waste my time there? No. I will focus on your problem areas and I'll try to
Yeah.
target those areas till the time those problems go away. Finally, coming to the solution. So then I'll look in for a solution made for you. For
Okay.
each candidate, it's a different solution. For tomorrow, if your friend
Okay.
comes and joins with you together, I cannot have the same solution for both of you, right? Because you are different people. You may be friends,
Right.
but her English level might be different. She might be a good speaker. You might be a good writer. I don't know that, right? So solution will be made according to the
Yeah.
individual basis. It will be tailor made according to your needs. When you go to a tailor, you give your measurement, they make clothes
Okay.
according to you. Here also,
Yes.
according to your weakness, it will be planned according to only you, not everyone else. The batches are not very big here. Okay, hardly I keep very
Okay.
less students, so that you get individual attention. Then finally we go for practice sessions. We do a lot of practice.
Okay.
Okay. Then this practice you'll become better with the practice, and finally we do
Okay.
mock tests. Only when you get sufficient, you reach a certain level, only then when I will tell you to book the exam, only then book the exam. Okay. This is the right
Okay.
methodology. Some people do it wrong. They go for exam, they just book the exam, then fail the exam, and then not fail, I would say, but they don't get the required score. And then again, they
Mhm.
waste that much money.
Okay.
Someone is trying to save money for coaching, someone is going for cheap
Okay.
options, and then finally what happens is disappointment. Then they keep wasting money.
Mhm.
I have seen people keep wasting money again and again and again. This is the correct method, not booking exam and then trying it. And if you want, I can assess you right here.
Yeah.
This is what I do.
Definitely.
I can assess you right here. I can tell you where you lack. Okay,
Okay.
so thank you very much for your presence. Okay, thank you very much, and
Thank you.
I hope you liked
Thank
it.
you very much, sir. It
So just
was
log in
really very
again.
informative.
Thank you very much. Just log in
Yes.
again if you want. This meeting is going to get over now within 1 minute. Okay, so you can log in
Okay.
again. We can discuss the questions. All right.
Okay.
Thank you. Thank you, viewers. I
Sure.
hope you
Thank
like
you so
this
much.
session. You can ask your questions in the comment section.